Hi, I'm Arshna Qureshi, a second-year pathology resident at Case Western Reserve University. I'm here with Dr. Rosalie Elenitsas. Dr. Elenitsas is a Herman Bierman Professor of Dermatology and Director of the Dermatopathology Fellowship at University of Pennsylvania. On behalf of the American Society of Dermatopathology, Dr. Elenitsas and I will have a brief conversation where Dr. Elenitsas will address some of the common questions that residents encounter while applying for dermatopathology fellowship. Dr. Elenitsas, thank you so much for joining me here today.
Hi, Arshna. Thank you for inviting me. I'm happy to be here.
Okay, so Dr. Elenitsas, it is that time of the year when dermatology and pathology residents are stressing out, having multiple conversations with their mentors, trying to put together a strong fellowship application. At least that's happening to me, which is why I'm so relieved that we are doing this, and hopefully this will help the applicants clarify some of their doubts and allay their anxiety. So let's just get right into it. So the first question I have for you is regarding the time to apply. Does it matter when in the cycle an applicant applies? For example, do you think applicants who apply as soon as applications open are prioritized over those who apply later?
Okay, good. Before I answer that, I just want to give you a little disclaimer that all my answers today are my opinion. They're not based on any data from other programs, so just my personal experience.
Okay.
So regarding when an applicant applies, it probably varies from program to program.
Okay.
And I would suggest that applicants look at the ASDP website and see which programs have signed up to follow the ASDP guidelines.
Okay.
So if they're on the list of following the guidelines, you know what their schedule is going to be.
Right.
And if they're in that list, they will likely treat all applicants equally, no matter when their application comes in. I know for our program, even if an application comes in the last day, it's treated the same as the one that comes in the first day.
Okay.
Having said that, sort of two qualifiers. One, you don't want to be late. Don't go past the deadline. And if you're applying to a program that maybe isn't on that list, so they're not going to go by the ASDP timeline,
right.
Maybe for those programs there is a benefit to applying sooner. So if if it's somebody who's going to look at applications as soon as they come in, then you might have a benefit by applying sooner.
Okay, that's pretty helpful to know because as you mentioned, there are some programs which follow the ASDP timeline and there are others which don't. So it's very confusing for us as applicants to figure out what is the best strategy for an application timeline. Well, the next set of questions I have are to understand what can help applicants improve their profile. For example, electives. What's your opinion on doing elective or audition rotations? Do you think they are necessary to be a competitive applicant?
No, absolutely they are not necessary. It's not really a requirement to do an away rotation. I know our two fellows coming in, they didn't do an away rotation with us. We met them during the interview. It's not necessary. Could it be advantageous? If you have particular interest in a specific program that you'd like to get into, then yes, it could be advantageous because the faculty will get to know you and hopefully find out that you're a good candidate. Of course, they could get to know you and find out you're not a good candidate. So not necessary, but advantageous if you have a specific interest in that program.
Okay, that actually brings me to the next question. What would you advise the applicants who have secured electives at the programs where they would like to pursue fellowship? And how do you think they can maximize this opportunity to get a favorable outcome?
So if you would like to do an elective at another hospital, the one thing to remember is you have to plan well in advance. So there are some things outside of the control of the faculty. There have to be agreements between the two hospitals. So I generally recommend to try to plan at least 6 months in advance to make sure that everything can get sort of squared away. And then once you're there, if you do an away rotation, it's sort of what we all know. Work hard, study, volunteer for things, put it out there that you're a hard worker. If you're interested in trying to do a paper during your rotation, a manuscript or a project, rotations are very short, so you might want to contact the faculty at that institution in advance, saying, I'll be coming, and this is my interest.
Okay. And do you think spending time in derm clinics increases competitiveness for path-trained applicants?
So spending time in the clinic itself likely won't improve your application that much. It will help a little because it shows your interest in learning dermatology. But in the end, it's not a big addition. What it does do for you is it does make you a better dermatopathologist. So as a pathologist, the more clinical derm that you know, it makes you a better doctor. So in the end, it does help you take care of patients.
I see. Okay. And the other question that I find a lot of applicants asking is if they should do a surgical pathology fellowship. Do you feel that path applicants with surgical pathology fellowship are more competitive than path applicants without any fellowship?
Essentially, no. I don't think it adds enough to do it for that reason, to get into a derm path fellowship. Similar to the last question, absolutely, it makes you a better doctor. It gives you more experience. And in the end, it may help you in getting a job, having the two fellowships. So I think there's where it would give you the advantage, maybe in getting a better job, but maybe not necessary to help you get into a fellowship program.
Okay, that's very helpful to know. And when it comes to choosing the program to apply, what are some of the important considerations to look for in the program?
Yeah, so there are a lot of different aspects of programs. I think the one thing we all think about, but it's very important, is the volume. So you do want to have a program with enough volume so you're seeing a lot of slides. And it doesn't matter that you see all the slides at the program, but if the program has a big volume, then they have better teaching material. And so you want to include all kinds of volume, right? Bread and butter. You want to see your basal cells and your seb-cares and the variety of the bread and butter. And at the same time, you want to see difficult cases and consultations. In a similar vein, variety of faculty. So there's nothing wrong with a program that only has one faculty member. You'll get to learn and think just like that person. But I think there's an advantage for multiple faculty members because you'll get different aspects on how to diagnose and how to produce reports. And it's good to see that variation. Another thing I think in choosing a program, you'll want to have a program with strong dermatology and pathology departments. So as you know, if you're a pathologist, you have to do derm training. If you're a dermatologist, you do path training. So you want good education there. But even when you do dermatopathology, you utilize the faculty in those departments. For example, we frequently will rely on our heme path or soft tissue pathology department to help us with some difficult cases we have. So, it's nice to have a strong department on the path side. And from the clinical side, you really want to learn good clinical path correlation. So you want to have good clinical dermatologists.
Okay, actually, that brings me to my next question. If it's advantageous for a derm-trained resident to apply to programs with, a lot more derm-trained faculty than path-trained, and for a path-trained resident to apply to programs with, more path-trained faculty?
Yeah, this is my opinion. You might get different opinions. I don't think it matters. I think path trained and derm trained dermatopathologists both are excellent and have strengths. And I don't think I would try to choose one. If you had the option of having both, some path background and derm background, it might be good. But in the end, I don't think it matters. I think you would get training that's great no matter what.
Okay. And what are the rotation requirements for derm-trained fellows in pathology versus path-trained fellows in dermatology?
Yeah, so the ACGME has specific rules for the requirements. The requirements, I will say, they're currently up for review, and so many programs are giving some input. So they might change in the near future, but currently, if you're path trained, you have to essentially do 4 months of dermatology. And if you're derm trained, it's 4 months of pathology. And what it ends up being is 8 months of half days. So you do a half day in derm and then a half day in half day in derm path, and then a half day either in derm or pathology. There are also specific requirements on the number of patients you have to see. So if you're a pathologist, you have to see 1,000 patients. If you're a dermatologist, you have to see 1,000 surgical path specimens plus 200 cytology specimens.
Okay. And a couple of questions regarding interviews. Do you anticipate interviews will be remote again this year?
Yeah, I think what will happen with interviews is it will be decided upon by each institution and likely be driven by their GME, their Graduate Medical Education Office, might drive that decision. Here in the Northeast, we're currently in a wave of COVID, and I predict that many programs will go virtual. It's suboptimal, but it does save the applicants money.
Right.
And I think if it's on the fence, there will be more programs choosing virtual this year.
Okay. And what can an applicant expect from the interview?
Well, I don't think it's any surprise. Applicants have already applied to either derm or path, right? And so I think that the interviews by the faculty, for the most part, might be similar, right? We want to know what motivates someone, what's motivating them for dermatopathology, what their goals are. It's not really a secret, but it is an opportunity for the applicant to show their personality, show off their communication skills. Maybe your CV isn't, loaded with manuscripts, but you're a great doctor and a great communicator. The faculty look for that. This is someone we're going to spend a year with, maybe 2 years with. We look for good communication skills.
Okay. And so a lot of other paths with subspecialty fellowship programs are joining the MAT system. Are DEMPAT programs considering joining a unified match in the future? And what are the pros and cons of a unified match that applicants should understand?
Yeah, so the discussion of a match has been going on amongst DermPath program directors for years. So this is an ongoing discussion.
Okay.
Yes. And so I do think that we will get there to have a match. What are the pros? The pros are, like you said, a lot of programs, other programs have a match. In dermatology, now the Mohs fellowship has a match. In pathology, other pathology fellowships have a match. So it would be good that we're on the same schedule as other programs. And importantly, we would all be on the same schedule. You wouldn't have these DermPath programs all on different schedules. And so what it would eliminate is somebody getting an offer for a position, but they haven't had the opportunity even to interview at another, maybe their first choice. They haven't even interviewed there, but now they're offered a position and they have to make that decision. So I think that's a big pro. What's a con? There is a cost associated with having a match. And also, if there's a match, you may end up interviewing at more places than you would without a match. And obviously that also has time and cost associated with it.
Right. Okay. And so now I want to get your opinion on job market. What does the current and future job market look like for graduating fellows?
Okay, well, I'll tell you up front, I don't have a crystal ball. So I don't have any magic look into the future, but I think you're asking this very good question because a few years ago, we saw a shrinking job market. There was decrease in the reimbursement for dermatopathology specimens. And so what happened was some dermatopathologists who were going to retire didn't. Some practices didn't take on more pathologists like they normally would because they were sort of holding on to the specimens because of that decreasing reimbursement. So we saw a decrease in the job market. And since that has happened, it has sort of remained steady on sort of what's out there. So I would say in the next few years, it's going to be similar. And so what does that mean? Does it mean there are no jobs? Absolutely not. There are plenty of jobs out there. What it means is you might not get the exact job you want in the exact location that you want. You know, your perfect job might be in Chicago, but you want to live in Philadelphia. And so that's what we're seeing now. Plenty of jobs out there, but might not be the perfect match.
Okay, and what changes do you see coming to the field in the next 5 to 10 years that future dermatopaths should know?
Yeah, I think that, some of the two big things that everyone's talking about, one is whole slide imaging, and another is artificial intelligence. Whole slide imaging, we've been using that for educational purposes. We're now seeing a shift where it's being used for daily sign out. I think that is going to happen, where we will be like the radiologists and do everything from our computer. I'm hoping it's a little slower. There is a big upfront cost to do something like that. The equipment is costly. You need extra staff. You need storage space. The other thing that it does that worries me is it's a little isolating, right? Sitting at your computer, staring at the screen. Rather be at the microscope with the residents and the fellows. But we'll be seeing more of that. And, artificial intelligence, I think initially sort of frightened everybody. Is it gonna take my job away? And I don't think so. I think it will just be a supplement to what we do. But it's still not clear exactly how that will play into our jobs, but we will see that coming.
Yeah, if isolation is one of the concerns, I think it will be for a lot of people. Maybe we will go for the hybrid approach that a lot of tech industry big players are doing. So one last question that I have for you is, what advice do you have for potential applicants who are considering applying to dermatopathology fellowship and want to learn more about the field?
Sure. If you're doesn't matter if you're a pathology resident or a dermatology resident. If you're unsure, really the way to figure it out is just more exposure, right? Spend more time in the field and see if you like it. And so an easy way to do that is just to approach your dermatopathologist, even if you don't know them, and ask for more exposure. This can be in the form of more time at the microscope, at sign out. It could be in the form of, teaching opportunities, looking at some slides. There are other opportunities that most programs have, such as attending conferences. For example, clinical path conferences, such as like tumor boards, or conferences that present patients and look at the path both. So you're seeing both of them, and to see, if you like those ends. Another good way, I think, is to join societies such as the ASDP. There's also the ISDP, the International Society of Derm. But the societies can give you an exposure to the specialty. The ASDP has things available on the website. There are, the quiz of the month, attending the meetings, both the ASDP, the ISDP meetings. They have something for people at all education levels. And so, and now we know there are a lot of hybrid or virtual things available. So maybe you don't have the money to attend something in person. Attending some of these virtual events can give you good insight into the specialty.
All right. Thank you so much. That was really helpful. This conversation has definitely helped me in clarifying a lot of doubts that I had. I'm sure my fellow residents would benefit from it as well. Thank you so much for coming here and having this conversation for me, Electives.
Great. Thanks again for having me. I enjoyed it.
All right. Well,
good luck to all our residents who are applying.
Yes, we need that. We definitely need that. Thank you so much again.